Perfect. How was that? Good? Okay. Perfect. Perfect. Okay. What do you think of that?
That was good.
Good. Perfect.
That was good.
Like that one?
Yes.
Okay. Okay. Perfect. Little bit. Harder. There we go. Perfect. Better. Not having as much of that popping and cracking, right?
Yeah.
Let's take a... There we go. See, that one moved pretty nice for us. Go ahead and pull back. Perfect. Loose. There we go.
Ooh. That was great.
Yeah. That's a wild one, huh?
That was crazy.
How you feel?
Oh my gosh, that was great. That was my favorite one.
How's everything going today?
It's going good.
Going good. I saw from your chart you're having some neck pain going down the right side into your shoulder.
Yes, like
Okay.
in my shoulder blades, like mainly my upper back.
Okay, so just everything between your shoulder blades and then up
And
into the neck. Okay.
Yes.
How does that feel? Is it like dull, achy, and tight? Is it sharp, like someone's stabbing you?
Like dull, achy.
Okay.
And then this shoulder, like it gets agitated really easily.
Okay.
I don't know, it's been like that for like a year or
Yeah.
more.
What types of things make it better or worse?
Working out, like doing anything like shoulders or bench press.
Yeah.
It's gonna get aggravated. Even like me just like blow drying my hair though,
Okay.
I get like if I'm using it, just gets aggravated.
And after it like flares up, is it just like super achy and
Yes.
like kind of throbbing in pain?
Yes.
Okay. And that lasts generally for a long time after your workouts, or?
Yes.
Okay, gotcha. So it sounds like
I'm
maybe
constantly just like trying to like contort.
Work it
What's
out.
it called? Contort my body. And,
Yeah.
like,
Okay.
find something that's comfortable.
And are you a personal trainer? Is that what you do for work?
No.
Oh, okay.
No, I just got out of the military actually.
Gotcha. Okay. Well, thank you for your service. I appreciate it. Okay, so we'll take a look at your shoulder, and we'll kind of take a look at the shoulder blades. Sometimes the neck can really play into
They
that.
did X-rays on it
Okay.
really recently, and they said it's normal.
Yeah, nothing came
So-
back. Yeah, and with X-rays, sometimes it's like if there's nothing broken or there's nothing like very clearly that's like dislocated, sometimes it's not very good at showing pain, especially if the pain's coming from the muscles or like the joint capsule and stuff like that. So
Yeah, I was like I was like, Marisa, you have arthritis. Like,
Yeah.
I don't know what's wrong with you, but it's something.
yeah, and it didn't show any like arthritic changes or anything like that on the X-ray.
No.
Okay. Yeah, it's not uncommon for patients who have like significant pain for the X-ray to come back completely normal. But what's good about that is we know that it's not broken, we know that it's not degenerated, or that there's anything catastrophically wrong. Which means that the stuff that we're going to do with you today,
It's
like
not gonna
adjusting,
Bother.
is not going to hurt anything, and then also is a good shot of making it feel better.
Yeah, hopefully.
So you've been to the chiropractor before, is that right?
Yes, but it's been like years.
Okay.
So,
Yeah. So-
this is not like something I do regularly.
Gotcha. Okay. So what we'll do is we'll just kind of see how well you're moving overall, and then we'll take a look at your spine, take a look at your shoulder, and just kind of go from there.
Okay,
So
you'll be able to like feel what's.
yeah, my job is basically to feel the normal motion in the joints and see if anything is stuck and not moving well, if anything's moving too much and needs to be stabilized. And based on what we feel and what we see with you, we'll be able to make a choice about what we want to do today.
Okay.
So let's have you sit up nice and tall for me to begin with. Yeah. So we're going to take the good shoulder overhead as far as you can, okay? And then bring the other shoulder overhead, okay? And then let's have you touch the thumbs above the head, okay? And then come down here, and then rotate in, okay? And rotate out, and rotate out. Okay, not too bad. So the shoulders look relatively even. I can see a little bit of like a lack of smoothness on that right side. And then let's have you bring your chin down to your chest. Okay, tightness through the back.
Yeah.
Okay, and then look up towards the ceiling, back as far as you can. Okay, come back down, look over your left shoulder, and then over your right. Okay, so you're moving pretty good in the neck there too. So let's see how
I
everything...
have been stretching.
Yeah.
I've been stretching a lot more, so.
Yeah, it looks like you're able to get into those movements, but it may just be that those movements are painful for you.
A little
So
uncomfortable.
let's have you have a seat right here. I'm gonna take a look at the shoulders.
Like on the
Perfect.
edge.
Yeah, no, let's actually have you spin around and face the other way. Perfect. Okay, so left shoulder's the good shoulder.
Mhm.
Okay. Yeah, we moved pretty smooth there. Let's see what's going on here. A little bit of popping and clicking. it feels like we're sitting a little bit forward in the joint on this one.
It feels like it needs to be like...
Yeah, come back that way.
Something like that. I don't know.
Yeah, so if you go here and put the arm in front of you, good, and then just relax everything. If I go here, is that painful?
Yes.
Okay. And then go straight out like this and hold it up. Don't let me push it down, okay? Is that painful there?
It's just a little.
A little bit. And then what if we go up like this? Is there more or less pain? Just go ahead and hold for me.
I'm sorry. It's just weak.
Yeah.
It feels weak.
Right. Hold your arms like this and don't let me push down. Okay. A little bit of like a resistance issue there. So we're going to feel the collarbone here.
It like goes into the back too.
As well.
Yeah.
Okay. Okay, we're going to go here. Yeah, you got that kind of repeated popping there. Very stiff here. A little bit of tightness through the shoulder blade.
Yeah, I know once you pop that.
Okay, so let's do this. Let's have you go face down,
Okay.
and we'll see how
Should I
things
take my
are.
shoes off?
No, you'll be okay. Yeah,
Okay.
good. And there's a little handle for you to grab onto right there. Perfect. Let's scoot you down just a little bit. Good. Okay, yeah. So got a little bit of these ribs are stuck there too.
The what?
Your ribs. So basically the rib cage has got to be moving well in order for the shoulder blade to move over the rib cage properly. And if the shoulder blade can't move over the rib cage properly, then it starts to give you shoulder issues. And so
That makes sense.
this right here is just not moving very well, and I think that that's probably playing into it. You also have a little bit here.
Yeah, that right one's so bad.
Yeah, okay. So we're probably going to do that from face up. Let's have you lay on your back, and we'll take a look at your neck here as well. You said the neck is worse on the right, is that correct?
Yeah.
Okay. Yeah, okay. Oh yeah, right there. Is that tender there? Okay. So we're going to start by adjusting that, okay?
Okay.
So we'll go nice and easy. I'm going to lift you up here. Good. Perfect. How was that? Good? Okay. I'll go to the other side here. Okay. Perfect. Okay. That moved super well for us. So let's get into your ribs and everything now. So scoot down just a little bit. Good. Okay.
Right there.
Yeah. So we're gonna come into this side for these ribs on the left. So this hand's gonna go here. This arm's gonna reach down my back, kind of like you're trying to grab the top of my pants, okay? So you're gonna give me like a little hug, all right?
Okay. It's sweaty.
That's okay. Sometimes people get sweaty after getting adjusted. Okay, relax the arm a little bit.
Which one?
This arm. Good. Okay. Breathe in, out, loose shoulder.
Ooh.
Perfect. Okay. What do you think of that?
That was
A
good.
little wild, huh? Okay, so now let's do the other side. So, same type of scenario. Go ahead, reach down my back. Good. Okay. Here. Okay. And we're going to put that hand right there. Good. Breathe in. Out. Loose shoulder. Good. Perfect.
That was good.
Like that one?
Yes.
So that was great movement there through the rib. And then let's have you go face down again and see how everything feels. Good. Good. Much better. Okay. A little bit here. So my hand's going to go under your hip here, okay? And I'm going to kind of use that like a handle. And then I'm going to give you a little push. So everything nice and loose. Good. How'd that feel?
Mm-hmm. There still needs to be more.
Yeah. Okay, breathe in. out. Okay. One more deep breath in, out. Okay. All right. And then let's do this. Breathe in, out. Good. Nice and loose. Perfect. Awesome. Okay. Great movement through there. Do a little bit of massage gun here to calm everything down. That feel okay? If you talk, you could sound like a robot, like when you were a kid.
Oh, to the van?
Yeah. Did you ever do that?
Yeah.
Talking to the fan?
How often is it good to get an adjustment done?
Just depends on what's going on with you. For you, I'd say probably something like twice a month, so every other week would be good to start with. Sometimes when people have really serious issues going on, we need to see them either once a week or sometimes even multiple times a week. But
Yeah, I am supposed to be starting physical therapy.
okay,
September 12th.
is it for the shoulder as well?
It's just like for joint pain overall.
Okay, gotcha. Okay, that's starting to loose up for us.
Yeah, those are always so tight.
Yeah. Now that we got that neck and the ribs and everything moving, this should start to calm down. Still a little bit tight over here. Good. Tight all through that neck too. Doing okay?
Feels good. But yeah, like even when I don't work out, my trap muscles are always just so like tight.
Yeah.
So it's not like from working out, it's just
Your neck and your upper back were definitely really stuck. And so when those joints aren't moving right, the muscles begin to spasm to try and basically get them to move right or kind of reestablish proper motion. And unfortunately, if the muscles aren't able to do that, then you just have really tight spasmed muscles and the joint is still stuck. And so hopefully by getting everything moving better here, that will start to calm down the muscle spasm and reduce all this tension that you're feeling all the time. Okay, so let's sit you up now, and you'll face away from me again. Doing okay?
Yeah.
So you'll face this way.
I started to get sleepy.
Yeah. You take a nap on me? Okay, so we're gonna take a look at the shoulder here. So we're gonna come across and over. Okay, and let's go here. So relax the whole arm. Good. Little bit. And then let's have you put that hand above your waist here. Yeah. Okay, relax the elbow. I'm gonna pull it towards me. And now I want you to pull back against me. So pull, pull, pull. Harder, harder, harder. There we go. Perfect. Let's see. Better. Not having as much of that popping and cracking, right?
Yeah.
Let's take a look over here. Good. And then we'll bend this elbow. There we go. Relax everything. There we go. See, that one moved pretty nice for us. Let's put that one on your waist and then go ahead and pull back. Perfect. See how easy that one went compared to the other side? Okay, let's have you lay on your back one more time. And we're gonna do one more adjustment here just to see if your collarbone. Scoot down a little bit. Okay.
My collarbone.
Yeah, sometimes if your collarbone's stuck, the whole, yeah, because feel how easy this is moving back and forth, and now feel this, how stuck that feels. So we're gonna do a little adjustment for your collarbone. With this hand, you're gonna put it on the back of your neck.
This one?
Yeah, just like that. So my hand's gonna come in right here on your collarbone and your chest, okay? And then this hand's gonna be under your shoulder. Good, so we're gonna come right here. Okay, and then relax the whole arm. Perfect, okay. Deep breath in. Out. Loose shoulder. Okay, little bit. Let's have you sit up and face this way again. I'll try one more here. So my hand is gonna go right here. I'm gonna come underneath your arm. There we go. And then just relax that arm for me. Perfect. Okay. Deep breath. Exhale. Good. Loose, loose, loose. There we go. Okay. Little bit. Yeah, still a little tough on that collarbone. But overall, things are moving much better for us. So let's do a couple of those motions again and see how everything feels. So you can have a seat right here. And kind of like we did at first. So we'll go overhead, overhead, okay? And then touch the thumbs, come down, rotate in, and out, okay? Yeah. How's that feel compared to before?
It does feel better.
Good.
I just feel like it needs more. I don't know.
Yeah. So you still have a lot of muscular tension around the shoulder, but as we continue adjusting you and as we work with you more and more, that'll start to go away. And then let's take a look at some of those neck motions. So bring your chin down to your chest as far as you can. How's that feel compared to before?
It feels good.
Less pulling. Good. And then look over your left shoulder and your right. Good.
Yeah, everything feels a little bit smoother.
Smoother, like looser, more fluid.
Yeah, it does feel like this needs to be like, I don't know.
A little bit? Yeah. Let's decompress you. So go ahead and lay face up on the table. Okay, let's scoot you down a little bit. Okay. So we're going to use a towel to decompress everything. So go ahead, lift that head up for me. Perfect. Okay. No pain there, right?
Mm-hmm.
Okay. So we're going to give you a little pull. So let's have you take a deep breath in, out.
Ooh. That was great.
Yeah. That's a wild one, huh?
That was crazy.
How you feel?
Oh my gosh, that was great. That was my favorite one.
All right. So that's the big one. That kind of decompresses everything and loosens everything up. So let's try some of those motions again and see if you still feel that way.
So good. Wait, which one?
Whatever you want. You can kind of take that neck for a test drive. That feeling you were having.
Yes, that feels so much better.
Good.
Oh, I'm so happy.
Good. Okay. Well, what do you think of your experience here today?
It was great.
Good.
So
Happy to
good.
help.
I'll come back soon.
Sure thing.